Welcome to Wednesday's edition of COVID-19. The daily tally here in Korea is fast approaching the 700 mark, and authorities are forecasting that tally may hit 1,000 next week if efforts to curb the latest spread fail. Accordingly, health officials are urging the need for greater public support in containing the third wave of this pandemic. I have our Kwon So standing by with more. So let's begin with the troubling jump in cases here in Korea today.
Yes, Sunny, troubling indeed. But it is a figure that health experts have actually been predicting for this week, if not even higher. 686 infections were reported this Wednesday, and this is the highest figure since early March when the country reported the same figure. And that means it is the highest since 909 infections were reported in late February during the first big wave of the pandemic here in the nation. Now, 662 of those were domestic infections, and that's almost 100 more than yesterday. And that brings the total figure here in the country to 39,432. If we have another daily figure tomorrow at around 600, the country is to surpass the 40,000 mark. The death toll stands at 556, but we also have quite a large number of new recoveries, bringing that total at over 30,000 now. And if we take a look at the daily trends now, we have 92 more cases compared to yesterday, and we also have an on-week jump by 175 infections. Also, for the past month, cases were in the triple digits every day. And a particular concern is in the metropolitan region, which means the capital Seoul, Gyeonggi-do province, and Incheon. This area reported over 500 domestic infections today, which is also a record high. Cluster infections are breaking out during day-to-day activities at multi-use facilities, schools, as well as companies, and many more. And also, just like in the past days, we have all 17 provinces and major cities with new infections.
Right, so given those alarming figures, I understand authorities are looking to expand their efforts to better contain this latest outbreak.
Yes, Sunny, as there are concerns that social distancing at this point may not be enough, government officials are calling on citizens to get tested for the virus, even if they do not feel symptoms but could have been exposed to the virus. And the number of untraceable cases is on the rise, which is why officials are now deciding to go ahead with more aggressive testing and also secure more hospital beds due to the rising figures. In fact, 149 patients as of Wednesday were in serious or critical condition.
Screening centers in the Seoul capital region will operate on extended hours and will remain open until 9 p.m. on weekdays and 6 p.m. on Saturdays and holidays. We will secure more hospital beds for critically ill patients by mobilizing emergency treatment beds in gradual phases. The number of ICU beds will be increased from the current 177 to 308 by December 20th and 331 by year-end.
Now, surging numbers of hospitalizations is, of course, also an issue around the world. If we take a look at this table now, we have 25 countries now around the world that have over 500,000 infections, and also 14 countries that have more than 1 million infections. If we take a closer look at some of the serious daily increases, we have the U.S. at almost 15.6 million cases and 222,663 cases reported in just a single day. Also, resurgences in Brazil, Germany, Mexico, and Turkey have been seeing over 30,000 cases on a daily basis in the recent week. And with that, the global figure now stands at 68.56 million. And those are the figures I have for now. I'll be back with more updates tomorrow. Back to you, Sunny.
All right, so thank you for that. Right, COVID-19 vaccination has become a reality over in the UK, and similar campaigns are in the forecast for the US and Canada. I have our Kim Hanil here in the studio with details on that. Welcome, Hanil.
Good afternoon.
So do start us off with details about the first person to be vaccinated in the UK.
Sure. So the first person to be vaccinated in the UK was a 90-year-old woman named Margaret Keenan, who's actually turning 91 next week. She said getting the vaccine was like the best early birthday present she could have asked for. Take a listen to what she had to say.
Just so strange and so wonderful, really. Yeah, so anyway, this is for a good cause, so I'm so pleased I had it done.
People in the UK started receiving their vaccinations yesterday in what has been dubbed V-Day. The UK is the first country in the world to administer Pfizer vaccines after the authorities approved them last week. The distribution of the vaccine is well underway now, as around 70 hospital hubs across the UK are preparing 800,000 doses to those over the age of 80, as well as frontline care workers. UK Prime Minister Boris Johnson also shared his excitement as he was on hand to witness the first vaccinations being carried out.
She's protecting herself, but she's also helping to protect the entire country. And people are having the vaccine for the first time, and it will gradually make a huge, huge difference.
The British government has ordered a total of 40 million doses of the vaccine developed by Pfizer and BioNTech, which is enough to vaccinate 20 million people, or a third of the UK population. UK health officials expect to have an initial batch of up to 4 million doses available by the end of this month.
Right. And meanwhile, health authorities in the US are poised to extend the green light to Pfizer as early as this week.
Right, with the U.S. coming off its deadliest week since the pandemic broke out, with the record number of an average deaths over the 7-day period, U.S. FDA may grant emergency authorization of the Pfizer vaccine as early as this week. A member of the FDA Advisory Committee said if the FDA commissioner approves emergency use authorization on Thursday, nationwide vaccinations could start immediately as early as Friday. Emergency use authorization will allow some adults to receive the vaccine, while the agency continues to evaluate its safety and efficacy. It isn't the same as a full approval, which can typically take months. This move could be critical at a time when U.S. health experts are warning that the country could face its worst public health crisis yet heading into the winter. Dr. Anthony Fauci said earlier this week that COVID-19 in the U.S. may likely peak in the middle of January, a period he described as a really dark time.
And in response to that dark time, the leader there, I understand, President Donald Trump, has issued an order calling for priority to American citizens with regard to vaccines. Tell us more.
Sure. So U.S. President Donald Trump actually signed an executive order yesterday to ensure Americans will receive priority access to vaccines once they become available before they're made available to other countries. So the signing took place at the White House during a vaccine summit in the hopes that it can allay fears of a possible shortage in the vaccines once distribution begins. The Trump administration said Americans will also receive the vaccines for free, and it is confident the U.S. will have enough doses of vaccines to inoculate everyone who wants it by mid-2021. However, it is still unclear how exactly this executive order will be enforced.
I see. Right, Hannah, one final question. I understand Canada could start vaccinating its citizens as early as next week.
Right. So Canadian Prime Minister Justin Trudeau said on Monday that Canada is expecting its first shipment of Pfizer vaccines as early as next week, with approval currently pending. Prime Minister Trudeau said on Monday that Canada will be receiving an initial batch of around 250,000 doses of Pfizer's COVID-19 vaccine before the end of December. He said this move will accelerate the timeline of Canada's vaccine rollout plan, and added that it's a positive development to get Canadians protected as soon as possible. Although only a limited quantity of vaccines will be available at the beginning, Prime Minister Trudeau noted that mass production will take place in 2021, allowing a majority of Canada's population to receive the vaccine, which will be provided free of charge.
Right, that's good to know. All right, Hannah, thank you for the coverage. I'll see you again next week.
See you then.
Right, authorities in the US have been recording more than 200,000 COVID-19 cases on a daily basis in recent times. And medical experts there believe the trend will persist as the country is soon poised to see a Thanksgiving-related surge. Now, for more, I have Dr. Ali Mokdad, the Chief Strategy Officer for Population Health at the University of Washington, joining me live. Hello, Dr. Mokdad.
Good afternoon.
Doctor, do start by telling us a bit about the COVID-19 situation over in the US.
So the US is in the middle of a winter COVID-19 surge. We have a record cases, record deaths, record hospitalization in the United States on a weekly basis, daily basis. We are concerned about overwhelming our hospitals unless preventive measures such as masks and safe distance are adopted by more Americans and state government dial back on some of the social distancing mandates to control the pandemic.
Dr. Mokdad, according to US media, the country is just days away from launching its vaccination campaign, but there are concerns about supplies and about convincing the public to get vaccinated. Now, the latter is a challenge, a concern that Dr. Anthony Fauci recently acknowledged as well. What is the public response there to vaccines?
So we need to address the vaccine hesitancy globally and in the US through proper communication to ensure that the public is confident in the safety of the vaccine. The US has secured 800 million doses of the vaccine, but of course, due to supply early on, we will not have enough vaccine for everyone who needs it. But we expect all Americans will have access by mid-year. We have a phased approach of vaccination here in the United States, medical staff first, elderly, and people with risk factors.
I see. Dr. Mokdad, I believe projections by your institute point to a frightening rise in fatalities in the colder months amid the pandemic. Could you please tell us more about this?
Because vaccines are arriving in January or later this month, they will not help us during this winter surge. So despite vaccination scale up, we expect in the United States about 539,000 cumulative deaths by April 1st. We will peak about 30,000 in mid-January in the United States. We project about 3 million globally from the beginning until April 1st. Korea, we expect 2,600. Avoiding even larger death tolls depends critically on us observing social mandates and, of course, wearing our mask when we are outside. If we scale up masks to 95% in the United States, we can save 66,000 lives between now and April 1st and about 500,000 deaths in the world between now and April 1st.
I see. That's a very gloomy picture. Meanwhile, a separate study by your Institute of Health Metrics and Evaluation, Dr. forecasts dramatic demographic changes in the global landscape in the next few decades. Would you care to elaborate on that, please?
Yes, our study showed that trends in female education, more women are getting better education these days, and access to contraceptives will increase the decline in fertility and slow population growth. So we forecast a sustained total fertility rate lower than replacement level in many countries, China, India, the United States, and Korea. Of course, our forecast of shrinking global population have positive implication on the environment, on climate change, on food production, but possible negative implications on labor force, economic growth, and social support system in part of the world with the greatest fertility declines.
Doctor, in your study, you mentioned Korea's current 53 million population dropping to 27 million 80 years from now. Are there any ways to better deal with this demographic decline?
Countries have 4 options to pursue in order to address this. First is to attempt to increase fertility rate by creating a supportive environment for females to have children and pursue their careers at the same time. Restrict access to reproductive health services, which is not a good idea. Increase labor force participation, especially at older age, and promote immigration. So it's worth considering how these options will play in each country. But a very real danger exists here. In the face of declining population, we are concerned that some state might consider adopting policies that restrict female reproductive health rights and access to services. So low fertility rate in these settings may become a major challenge to progress in females' freedom and rights. So we are concerned about that.
I see. All right, Dr. Mokdad, thank you very much for making the time to join us live at this hour with your insights.
My pleasure.
Right, it's time now for part 5 in our special coverage of Korea's free economic zones. And as always, I have Peter Bent here in the studio with me. Hello, Peter.
Hi, Sunny.
Now, Peter, I hear you'll be talking about the Daegu Kyongbok Free Economic Zone today.
Yeah, quite a mouthful, so known as DGFZ for short. It's in collaboration with the local governments of Daegu and also Gyeongsang-Buk-do province. It includes a partial section of Daegu, which is situated in the southeastern part of the Korean peninsula, and also the cities of Pohang, Gyeongsan and Yeongcheon. As a global city, Daegu hosted the World Energy Congress in 2013, the World Water Forum in 2015, and is set to host the 2021 World Gas Conference. Gyeongsang-Buk-do province features beautiful natural scenery and it's near the East Sea. Also home to a UNESCO World Heritage Site, the province has long history and a rich heritage.
Right, Peter. I'm sure you're also aware, but earlier this year, the region was the epicenter of the pandemic.
Yeah, absolutely. So Daegu and Kyongbok were really slammed by COVID-19 with the highest confirmed cases in South Korea. There were more than 8,000 confirmed cases in Daegu and Kyongbok province. But thanks to the efforts by residents, medical staff, the administration and local governments, cases began dropping in April after reaching a peak in late March. And now the situation, you could say, has stabilized.
Right, more or less. And I understand Daegu has been working to turn the COVID-19 crisis into a business opportunity.
Yes, actually in 2008, Daegu established the first medical industry bureau for a city in South Korea and has been awarded the grand prize for best medical city for 6 consecutive years. It has many medical companies contributing to the development of the medical industry. So even during this COVID-19 crisis, several startup companies have overcome these grim circumstances by leveraging their excellent technology and innovative strategies. A tenant company in DGFZ, I should say, Shinseol Medivalley, developed 2 COVID-19 test kits that drastically reduced the diagnosis results time of COVID-19 testing from more than 6 hours to just 20 minutes through close collaboration with the New Drug Development Support Center. Another specialized medical device company also successfully developed a COVID-19 sample collection kit. And these 2 companies have each received an in vitro diagnostic product export license from the Ministry of Food and Drug Safety for their test kits and sample collection kit respectively, and are currently exporting them.
That's quite an achievement. Peter, there have also been some remarkable investments in the area despite the pandemic, I hear.
Yeah, one R&D company in particular will invest almost $300 million, 277 to be precise, in Pohang Fusion Tech District to build a smart healthcare city, and a medical device company will invest a further $4 million in the next year to build a clinical laboratory and production plant for the research and development of bone marrow-derived stem cell treatments. Another testing equipment manufacturer will spend $3 million to build a parts and materials plant by 2023.
Right, so why did they choose to invest in this particular zone?
Well, it's becoming a bit of a biotech industry hub. They want it to be a cluster there. So tenants in the DGFZ Pohang Fusion Tech District, which is designed to be that cluster in particular, and also for advanced components and materials. The fact that tenant firms can collaborate with R&D centers, manufacturing plants, and supporting facilities is a big reason why they chose to invest here.
And how is the zone preparing for future changes in the industrial landscape?
Well, DGFZ is looking towards the 4th industrial revolution. Let's see an overview of DGFZ, which proactively fosters future industries as it strives to become a base for global new industries such as IT convergence, advanced parts and materials, green energy and medicine. DGFZ has established itself as an industrial hub in Northeast Asia since opening in 2008.
Medical, robotics, ICT, and new material industry have been the key driving forces for its development. Since then, in the last 12 years, DGFZ aggressively attracted $618 million from overseas companies and 5.8 trillion Korean won from domestic company and organization. On top of it, 17,000 jobs have been created by its investment.
The IT convergence industry will be the core of the fourth industrial revolution undertaken by DGFZ, along with the high-tech medical industry that will realize the dream of extending human life. The advanced transportation machine parts industry, which is the backbone for most industries, and the energy industry that is reinventing a sustainable future for the planet. These four industries with great potential for growth will be fostered as innovative industries for the future.
There are top 4 priorities for foreign direct investment. First is accessibility, second is the environment, and third is infrastructure, and fourth is business and human resources.
Regarding the first investment criteria, DGFZ boasts excellent accessibility through a solid transportation network. 8 expressways, more than 100 KTX trains departing per day, 7 nearby ports, and 3 international airports in the area allow easy access to nearby cities and world-class companies. DGFZ has a robust business environment and skilled workers that fulfill the second criteria for investments. Korea's top companies such as Samsung, LG, and POSCO are located in the area, with more than 500 foreign companies also doing business here, creating an environment for mutual growth.
So Peter, how are the zone's industrial districts divided and what are their features?
Well, DGFZ is divided into 8 industrial districts that are spread across cities like Daegu, Pohang, Gyeongsan and Yeongcheon, and each district leverages its core business focus to advance the industry. The Technopolis in Daegu fosters robotics and mechatronics, while the International Fashion District is home to an international fashion design complex. At the Shinseol Medi Valley, the main focus is bolstering Korea's virus containment measures, and in Susong Medical District, medical tourism and building a smart city are the main pursuits. Gyeongsan Knowledge Industry District in Kyongbok Province has a business focus on transportation components and new medical materials, and the Pohang Fusion Tech District is centered on South Korean biotechnology, while the Yeongcheon Industry District is developed as an industrial cluster for parts and materials, and the Yeongcheon High-Tech part has the goal of becoming a futuristic automobile parts valley in preparation for post-COVID-19. And DGFZ, I should say, is changing with the new paradigm of a reorganized free economic zone in South Korea.
Peter, what does this reorganization of the zones entail for this particular region?
Well, it's adopting the government's reorganization of priorities, which used to focus more on attracting foreign investments. And instead, they are going to go with development projects, and DGFZ has quickly refocused in this respect. The main focus now is to attract investments to build an innovative ecosystem by linking the skilled workforce, businesses, universities, research facilities, and supporting agencies together.
And what is the importance of creating this industrial ecosystem, so to speak?
So when you're attracting the corporate investments, it used to be the case that manufacturing businesses focused on manufacturing output. So if building a factory site was cleared to proceed, it was easy to attract investments. However, as industries in the fourth industrial revolution possess various patented technologies and leverage them to commercialize new technologies, more conditions need to be met to attract an investment. And one condition that needs to be met is the presence of supporting agencies, suppliers, and R&D centers that can kickstart mutual growth. So in order to nurture future industries, a core requirement is to create an innovative industrial ecosystem that can create synergies together.
I see. Peter, what has been the response to such efforts then?
Well, receiving the full support of the Daegu Kyongbok Free Economic Zone and the authority there, some companies are expanding their businesses. So we visited Daegu Technopolis to see Hyundai Robotics. Let's take a closer look. Hyundai Robotics is the top industrial robot producer in Korea and ranked number 5 in the world. Starting its robotics business in 1984, Hyundai Robotics began producing welding robots for the first time in 1987. In 2018, the company reached a milestone by producing a cumulative 50,000 units, which was a first in South Korea.
산업용 로봇을 라인업하고 또 소형 로봇까지 작년에 개발을 완료했고요. 협동 로봇까지 생산을 하고 있습니다. 향후에는 로봇과 더불어서 스마트 팩토리 구축 사업, 또 로봇 물류 시스템 사업 확대를 위해서 지금 열심히 발전하고 있는 회사입니다.
Developing its own proprietary technology, Hyundai Robotics is currently pushing ahead in the industrial robot, cleaning robot, and robotic system business. It was awarded for its automobile welding robot and cleaning robot in 2008 and 2011, respectively. Hyundai Robotics started out as a robotics division in Hyundai Heavy Industries Research Labs, and after it was spun off in 2016, it became a tenant firm at Daegu Technopolis to establish a production base for future growth. Why did Hyundai Robotics choose to settle in DGFZ?
대구시 전체를 로봇 특구로 지정을 해서 로봇 산업을 지원하자는 방침이 있었고, 저희 현대 로보틱스뿐만 아니라 주변에 저희 관계된 계열사, 계열 협력사, 부품 협력사들도 같이 이전을 해서 자리 잡을 수 있는 그런 조건이 좋았죠.
As interest in the contactless industry is predicted to increase after COVID-19, the company is putting more effort into gaining competitiveness in the fully autonomous automation business.
Meanwhile, what other efforts are being made by authorities there, Peter, to attract investments?
Yes, and in these times of contactless, DGFZ is really building an era of commerce without having to meet in person, as these precautions are becoming very commonplace. Using video conferencing marketing as a strategy to attract investments, it successfully held the world's first contactless investment presentation using augmented reality and virtual reality technology. Through this approach, it expects to win foreign investments amounting to about $4 million.
Wow. What are the benefits for those that choose to decide to set up shop in the zone, that is?
Well, similar to the other free economic zones, there are tax reductions, funding opportunities, one-on-one customized one-stop administrative services as well, which are crucial. Foreign schools, campuses and hospitals have been built also to create a high standard of living. And most of all, investors are most satisfied with the business matchmaking service. It's a service that connects companies in Daegu and Kyongbok province, which are eager to attract foreign investment with foreign investors. In addition, the DGFZ works hard to open new sales channels for domestic companies, and it will find interested overseas buyers and connect them to tenant firms to drive up sales.
Quite a productive platform, no doubt. All right, Peter, as always, thank you for that.
Thank you very much.
Right, back here in Seoul, small-sized unmanned stores are gaining popularity amid the pandemic, given the preference for non-face-to-face interactions and restrictions under the current level 2.5 social distancing that requires large retailers to close shop at 9 in the evening. We have details in this next report.
Hi, it's 신새벽. The word unchecked, which refers to contact-free, has become quite familiar to us. And unchecked consumption is where a consumer does not meet face-to-face with a provider but use the service. And today I am here to introduce you guys some automated cashless stores that have been on the rise since COVID-19. The content-free economy emerged far before the COVID-19. We could order food or buy movie tickets using kiosks, and of course, we could find self-service laundromats around us easily.
코로나 사태로 이동이 어렵고 이제 생존을 위해서 비즈니스가 계속돼야 되니까 이러한 비대면 기술들이 적극적으로 채용될 수밖에 없었습니다. 그러니까 필요가 발명의 어머니라는 속담의 현실적 적용이라고 보고요. 이러한 기술 도입이 언택트 사회를 사실상 10년 이상 앞당긴 것으로 평가할 수 있습니다.
It is midnight, time to get off work for the operator of the store. Before he leaves, he presses a button. Then this ordinary store turns into a smart supermarket.
지금부터 무인 편의점으로 전환됩니다.
It's a little past midnight. That means between now and until 9 a.m. in the morning, the supermarket will turn into an autonomous store equipped with cutting-edge technologies. To enter the store, you first need to insert your credit card to ensure that you are a visiting customer. Because teenagers can also enter the store during the night hours, the cigarette display will be automatically shuttered so that they cannot buy such products. These are refrigerators for drinks. You can buy soft drinks, but liquor, you cannot buy it because it is automatically locked.
무인 점포 이전에는 영업을 24시간 할 수가 없는 그런 단점이 있었는데요. 왜냐하면은 뭐 알바비라든가 이런 비용이 너무나 코스트 비용이 비싸가지고 무인을 운영할 수 없었지만 지금은 정부에서 지원해준 무인 결제 시스템 키오스크로 야간에도 손님이 오시고 그래가지고 매출이 늘어나니까 저는 좋습니다.
The Ministry of SMEs and Startups began a new project that supports small business owners who are having difficulties adjusting to changes that occurred with COVID-19, such as the Contact-Free Economy and digitalization. From shopping to checkout, everything is running in self-service. That's why it is gaining so much popularity among people. So what are prospects of consumption trend in the upcoming contact-free era?
새로 구축된 언택트 시스템이 기업 비용을 절감하고요. 또 한편으로는 소비자들에게도 이용해야 하는 불편함이나 시간을 절약할 수 있거든요. 그러니까 이러한 비용 절감은 새로운 투자를 나올 거고요. 또 소비자들에게도 더 많은 활동을 할 수 있는 공간을 만들어 줄 겁니다.
The Ministry of SMEs and Startups said there would be around 4,000 smart stores across the country by the year 2025. The unmanned store has indeed become a very interesting change in consumption trends that have occurred ever since the pandemic. This has been 신세경.
정부는 당초 계획보다 약 1,400만 명분이 더 많은 최대 4,400만 명분의 백신을 확보하였습니다. 내주도 3월을 시작으로 단계적으로 도입될 예정입니다.
COVID-19 vaccines are making headlines this week as the UK launched its vaccination campaign yesterday, and similar initiatives are in the works over in the US and Canada. Now, authorities here in Korea, for their part, have shared their vaccine agenda. And for more, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you.
And I also have Dr. Alice Hyung-Tan from Ms. Medi Women's Hospital. Good to have you back, Dr. Tan.
A pleasure to be here.
Professor Kim, officials have revealed intentions to secure vaccines for 44 million people and to start vaccinations, as seen in the video, from March next year. What are your thoughts on the size of the procurement and on the timing of the vaccination program?
Well, countries like USA or UK are having a community transmission, and they are
urgent to prepare a huge amount of vaccination. But Korea is still a cluster of cases. That means less urgent than other countries. And if we add the numbers of the high-risk group and the personnel working for the emergency medical service and the hospital personnel, it's going to be about 40% of our total population. And I think government wants to prepare more than that, about 60% of our need. And well, vaccine is not the only way to control COVID-19. We have to continue with personal hygienes. But still, it's wise to preserve more early and sufficient amount to fight against this pandemic. So at the condition that the vaccine is safe and effectiveness.
Right. Dr. Tan, I believe Korea is seeking to secure vaccines from 4 pharmaceutical companies, including AstraZeneca, Pfizer, Moderna, as well as Johnson & Johnson's Janssen. This move apparently comes at the recommendation of health experts. What are your thoughts, or is there a reason that is for this broad purchase?
Right. We wanted to diversify our portfolio of available vaccines in order to offset the risks inherent in the procurement process. So normally we wait until phase 3 trials are complete. And actually, phase 3 trials are set to be done for COVID-19 vaccines 2 years after their beginning. So we're just looking at data from the primary completion dates, the first part of phase 3 for these vaccines. Basically, what we're doing is we're, so to speak, putting our eggs in multiple baskets. We're choosing the baskets based on their highest probability of ultimate success. And we're having to do this because of the urgency of the situation and also because of the astronomical demand in the face of limited supply. Pfizer and Moderna, they just finished that first phase, first part, I would say, of their phase 3 trial. Janssen, they just started their phase 3 trials as of November 16th. And AstraZeneca is due to complete that first part of phase 3 March of 2021. So that's why we wanted to diversify, because we're not sure what we will end up with when we actually need the vaccine.
Right. Professor Kim, according to some pundits, the viral vector vaccines developed by AstraZeneca and Johnson & Johnson, that's Janssen of course, have lower efficacy when inoculated multiple times. What are your thoughts on this?
Well, first of all, there are a lot of methods to make vaccination. So totally it's about 40 cases, 40 models in phase 1, 17 in phase 2, and 13 in phase 3. And this adenovirus vector type vaccine, there are more than 20, and the AstraZeneca and Johnson & Johnson belongs to that type. It's more than 70 years since we started to have that adenoviral vector type vaccine, and this method right now is more than almost 40 years since we started. So it's good that because it makes robust immune response and increase the cellular immunity, but as you mentioned, the human response against that vector causes some low efficacy. So that's the problem. But anyway, immune response for coronavirus lasts for only 6 months. Any kind of vaccination or natural infection, including all of them. So any type of vaccine still needs preparation for the second or third infection. So we have to look at the whole picture.
I see.
Yeah.
Dr. Tan, I believe vaccine companies have been shielded from civil liability in the case of side effects owing to or after inoculation. As a health professional yourself, what are your thoughts on this?
I think this is a liability that we are forced to accept because of the exceptional, extraordinary circumstances of COVID-19, this pandemic. Basically, as I said, phase 3 trials are usually carried out for 2 years. But we are going to start, obviously, vaccinating people before that 2-year period of full monitoring. We're basically going on the best data available, and fortunately, the data has been reassuring in terms of safety and efficacy. The Korean government will be carrying out its own safety trials once we get the vaccines in our country to make sure that they are safe for our citizens before they're rolled out in the spring of 2021. Also, these vaccines will be part of our national immunization program. And as part of that program, the government guarantees any reimbursement if there are adverse effects among people who receive the vaccine. So although there is inherent risk, I think we do have a good safety network in place, and the vaccines that are rolled out for our citizens will be safe and effective.
Professor Kim, I understand children and teenagers cannot be vaccinated as of yet, owing to the lack of sufficient clinical results. In fact, where do we stand with regard to vaccination efforts for the younger population?
Well, generally, always drugs for children comes the last time, because if it's safe for the adults, then you can use for the children. The clinical trial is same. So if you finish and have all the results for the adults, then we start the study for children. There are two aspects in this issue. Safety is a huge issue concerning in children, and children are impossible to make their own decision. And most of the vaccine models, they have to give 2 shots. If you have some bad memory for the first one, you have to persuade for the second shot. So that's one issue. But luckily, COVID-19 is mild for children. And maybe it's because of the research expressed in children are lower, so the virus cannot bind to them. And the other one, children are recently vaccinated with other kinds of vaccinations, which causes non-specific immune booster. That might help the children get prevent children from getting infection. And lastly, I want to say some mention about the Swedish model, because they didn't close the school. There's no school absence in Sweden for elementary school and junior high school, and they say that there's no problem with that. So I wish that we can study the models of Sweden, and we can lower the problems coming after the school absence.
Dr. Tan, I believe there is much global attention focused in the UK at the moment for the actual effects of vaccination against their fight against the pandemic. What should we be looking for apart from safety? Is safety the main focus for you as well then?
Right, safety, but also just logistical feasibility. In other words, are the manufacturers going to be able to manufacture the tens of millions, actually billions of doses? There are talks now about shortages of raw materials, of the glass vials that we need to package these vaccines. We have to keep an eye on the cold chain transport, because we need ultra cold chain for the Pfizer vaccine. Whether or not also the vaccine will be rolled out in an equitable manner globally. We have to be aware of this and make sure that this happens, not just for the rest of the world, but for our safety as well. Adverse effects, of course, we need to keep an eye out for. AstraZeneca just came out with interim results from their phase 3 trial, and there were actually 2 cases of a neurologic condition called transverse myelitis. One was thought to be unlikely related to the vaccine, and the other was possibly related to the vaccine. And so this is something that we need to look out for. Both cases did recover, but I am a little bit concerned about this. And then durability. How long are these vaccines going to last? We're not sure. One expert from Korea yesterday in the press conference said that if we look at animal models, animal studies, it doesn't look like these vaccines are going to last very long. And so we have to, be on the lookout of when do we need to do boosters. And then in terms of course, virus escape. So, if and when, probably for sure the virus will mutate at some point due to evolutionary pressures. Will we be ready for the mutated form? Fortunately, with the mRNA platform, pharmaceutical companies have said that it will be relatively easy to modify how they make the vaccine to match the new mutated variants. But of course, these are all things that we have to keep an eye out for.
Right. Meanwhile, Professor Kim, there has been some positive news on the local front with regard to blood plasma therapy, I hear. Could you tell us more about this?
Okay, yeah. It's very encouraging because we have one more weapon to fight against this pandemic. And last time I told you that there are so many known factors and unknown factors when we mention about plasma therapy. The product is called GC5131A, and it's from more than 2,000 donors, and we made a high hyperimmune globulin out of it. It's very specific and a titrated type of convalescent plasma. If we use it early in the course with the high titer antibody, I think it's beneficial. And still, we have some adverse effects like allergic reaction. So it just started, and it needs a randomized control study. And I wish we can make a study comparing with monoclonal antibodies.
Right. So we still have to wait and see then.
Yeah.
All right, Professor Kim, as always, thank you for your thoughts.
Thank you.
And Dr. Tan, thank you for being with us today.
Thank you.
Right. According to the World Health Organization, transparent disclosure of accurate information about COVID-19 will serve to better tackle the pandemic than simply calling on people to get vaccinated. Having said that, we'll be back tomorrow with more accurate information about the virus. Thank you for watching.